Medical Officer, the Department of Ayush Karnataka since 15 years. And his presentations were he presented, Dr. Nagendra Char sir presented 10 papers, including 2 international journals. And their publications are he is a regular writer, and he published more than 50 health related articles in Kannada periodical, and 3 scientific papers published. Then his service related, so he conducted more than 20 Ayurvedic medical camps. And then Dr. Nagendra sir's area of interest is management of Manasa Roga, then particularly male and female infertility, and also neurological disorders and cosmetics. So presently, Dr. Nagendra sir is pursuing a in-service PhD at Government Ayurvedic Medical College, Bangalore, which is affiliated to Rajiv Gandhi University of Health Sciences, Bangalore. So this is a brief introduction regarding Dr. Nagendra Char, sir. And today the topic we have kept is an Ayurvedic approach to the male infertility. So now I would like to welcome Dr. Nagendra sir for their session. And now the session is yours, sir. So you can start your presentation. Thank you. Thank you very much.
Hari Om. What happened, Dr. Sadanand? Dr. Sadanand? Is there any problem? Dr. Sadanand, please unmute yourself.
Yes, sir. उनका थोड़ा कुछ इश्यू हो गया, कट हो गया, फिर से रीजॉइन हो रहे सर.
Okay. No problem.
Hello.
Yes. You are audible,
Sir.
Dr. Nagendra Char.
Yeah.
Dr. Sadanand, please moderate.
Okay, sir.
Hello.
Sir, share ಮಾಡಲು ಏನು ಇಶ್ಯೂ ಆಗ್ತಾ ಇದೆಯಾ ಸರ್? ಹಲೋ, ನಿಮ್ ಸೌಂಡ್ ಕೇಳಿಸ್ತಾ ಇದೆ ಸರ್.
ಸರ್
ಹಾ ಸರ್ ಹೇಳಿ.
Yes, now you are visible also. Kindly continue, doctor. You are visible, sir. Dr. Sadanand,
Yes, sir.
please communicate with him.
ಸರ್ ನಿಮ್ ವಿಡಿಯೋ ಕಾಣಿಸ್ತಾ ಇದೆ ಸರ್, ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಸೆಷನ್.
ಹಾಂ ಸೌಂಡ್ ಕೇಳಿಸ್ತಾ ಇದೆ ಸರ್. ಈಗ ಶೇರ್ ಮಾಡಲ ಸ್ವಲ್ಪ. ನನ್ನ ಇದು ಶೇರ್ ಅಂತ ಇದೆ, ಮಾಡಲ ಈಗ? ಓಕೆ 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 ಓಕೆ. ಈಗ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ಸರ್? ಹಲೋ ಹಲೋ.
Yes, you are audible.
ಎಸ್ ಸರ್, ಎಸ್ ಸರ್.
Please continue.
ಓಕೆ ಸರ್. ಅದೇ
ಅಲ್ಲಿಗೆ ನೋಡ್ತಾನೆ ಕ್ಲಿಕ್ ಮಾಡಿ ಮಾಡಿಲ್ಲ, ಬೆರಳು ಬರ್ತದೆ ಮಾಡಿಬಿಟ್ಟು ಓಪನ್ ಆಯ್ತಲ್ಲ, ಅದಕ್ಕೆ ಏನು ನೋಡಬೇಕು. ಇನ್ನು ಹಾಕಬೇಕಿಲ್ಲ, ಅಲ್ಲ ಬಂದಿತ್ತಲ್ಲ, ಅದೇ ನಿಮಿಷ. ಯಾವುದೇ ಇನ್ನು 2 ಬಂತು. ಆರಂಭೇಶನ ಪರಿಣಾಮವಾಗಿ ತೋರ್ತಾನೆ. ಶೇರಿನ ಕ್ಲಿಕ್ ಆಗ್ತಾ ಇಲ್ಲ ನೋಡ್ರಿ, ಬಂದಾಗ ಹಿಡ್ಕೊಳ್ಬೇಕು. ತೆಗೆದಿರ್ಬೋದು. ಇಲ್ಲಿ ಯಾವುದು ಅಪ್ಲಿಕೇಶನ್ ಸ್ಕ್ರೀನ್ ಇದಲ್ವಾ ಕೇಳ. ಸ್ಟಾರ್ಟ್ ಕಂಟಿನ್ಯೂ ಕನೆಕ್ಟ್ ಆಗ್ತದೆ. ಅದು ಕನೆಕ್ಟ್ ಆಗ್ಬೇಕು. ಅದರ ತಕ್ಷಣ ಇದನ್ನು ಓಪನ್ ಮಾಡ್ಕೊಳ್ಳೋಣ. ಆಗ್ತಾ ಇದೆ ಅದು. ಹಾಕಿದ್ದೀನಿ, ಇಟ್ ಇಸ್ ಕನೆಕ್ಟಿಂಗ್, ಟೇಕಿಂಗ್ ಟೈಮ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಅಂತ ಶೇರ್ ಇದು ಶೇರ್ ಅಂತ ಬಂದಿದೆ, ಹಾಕಿದ್ವಲ್ಲ ಶೇರ್. ಅಲ್ಲೇನಿದೆ ಅಪ್ಲಿಕೇಶನ್ ಎಂಟೈರ್ ಸ್ಕ್ರೀನ್. ಅಪ್ಲಿಕೇಶನ್ ಇಂದ ಇದನ್ನು ಅಲ್ಲೇ ಒಂದೇ Yeah. Medalist. Still no problem.
Okay. Hello.
ಸರ್ ಹೇಳಿ.
ಶೇರ್ ಮಾಡಿದ್ದೀನಿ ಸರ್. Can I start now?
ಇವಾಗ ಕಾಣಿಸ್ತಾ ಇದೆ ಸರ್. You can start.
ಕಾಣಿಸ್ತಾ ಇದೆಯಾ? Can I start?
You can start sir.
Continue.
Okay. All the best.
Thank you sir. Thank you sir.
ಅದಲ್ಲ ಅದನ್ನ ನೋಡಿ.
Good evening. Hello, I am audible, sir.
Yes sir.
Hello.
You are audible. You can start your session.
Okay, sir. Thank you, sir. Good evening, everyone. Respected chairperson and guests of today's session, and my friends who are joined, and my well-wishers. Today, I am sharing my experience and male infertility. Male is a burning issue. Day by day, it is increasing, and decade also by day also. Every year, we are seeing so many cases. The male infertility, it contributes 50% of the total infertility. And the patient seeks Ayurveda advice. Nowadays, it is becoming very popular to take an Ayurveda treatment, and the popularizing of Ayurveda treatments, because we are seeing so many cases which are failures in the some ART, ART assisted reproductive technologies like IUI and IVF, and miscarriages and unexplained infertilities, the complicated cases, and the patients, they were come to the Ayurveda doctors or physician, they are having idea of there is no side effects in the Ayurveda. That is the only one. It is one of the cause to come over to take the treatment. And some of the references who already success cases are from the success case. They have some friends. They will refer some cases to the doctors, like relatives and friends, and by publicity also we have so many cases. Publicity means by media and Facebooks and WhatsApp and free medical camps, we have a number of cases like advertisements, and they will, by the advertisement, they will consult the Ayurveda doctor. We have some so and such problems, can you treat, sir? Like that, the so many patients will approach to the Ayurveda doctors, and fear of some surgeries, they advise surgeries also, they will come to the Ayurveda doctors. And prerequisites for the physician. Prerequisites, and there is a requirement for a physician for a trust. Trust is one of the most important prerequisites for a physician, because trust is very important. Trust himself, and trust to the Shastra, trust with the patient, and Shastra and Shastrarthas. And Shastrarthas means we have to update ourselves regarding Shastras. Skillful utilization of the treatments and therapies, and openness of the exchange of the experiences. It is very important today, because if you have succeed some of the cases, means we have to share our knowledge to the youngsters and budding doctors to encourage Ayurveda system. And publications also, by the scientific publication, we'll update ourselves. So all of you know the infertility, but once again I am repeating the definition. Definition according to WHO: the failure to achieve a clinical pregnancy after 12 months or more regular unprotected intercourse. And male infertility means inability to propagate in a fertile a female partner. It is called male infertility. The primary infertility, who never have a child, means it is called labeled as primary infertility. And secondary infertility means the history of previous conceptions. If it is there, the conception or pregnancy it is present in labeled as secondary infertility. If they are trying for a second, the primary they got some abortions or miscarriages, then they will go for their training, means it is labeled as secondary infertility. So as per the WHO estimation, 60 to 80 million of couples, 8 to 12% of the worldwide, they are having suffering from infertility. The prevalence in India, the ranges between 3.9 to 16.8%. As per the recent report, India, nearly 50% of male infertility or 40 to 50% of male infertility with sperm concentration and motility and morphology. Before the treating or knowing to know the disease, there is a need of to know a proper anatomy and physiological functions of male reproductive system. It is very necessary. That's why to know the to have to know the anatomy of the male reproductive system. Male reproductive system, it has got primary sex organs, testes, and secondary sex organs, seminal vehicles, and prostate glands, bulbourethral glands, and penis. The testis is made up of 900 coiled tubes, and they are known as seminiferous tubules, by which they produce these sperms. The seminiferous tubules continues as vasa efferents, which form the epididymis, which continues as vasa.
Is there any problem, Dr. Sadanand?
Hello.
Please communicate with the speaker and resolve that problem.
Okay.
Dr. Sadanand?
जी सर, वहां पे उनका नेटवर्क इशू आ रहा है, वो फिर रिकनेक्ट कर रहे हैं सर।
तो ये आप बोलते रहिए ना बीच बीच में, क्योंकि ऑडियंस है यहाँ, तो प्लीज इसको बोलते रहिए।
ಹಲೋ, ಸ್ಟಾಪ್ ಶೇರಿಂಗ್ ಮಾಡಿ ಮತ್ತೆ ಶೇರ್ ಮಾಡಿ ಸರ್. So due to network connectivity, connection is lost by Dr. Nagendra sir, and again he trying to rejoin it. Sorry for the technical issue.
जब तक वो जुड़ रहे हैं तब तक डॉक्टर सदानंद, सदानंद, डॉक्टर सदानंद,
जी सर.
तब तक तुम अपना प्रेजेंटेशन दिखा दो। मेल इनफर्टिलिटी पे झंडू के क्या प्रोडक्ट्स हैं? हरिओम। मत कर तो फिर कुछ तो बोल मेरे भाई, नहीं तो उससे बुलवा, नहीं तो खत्म कर, कुछ तो कर मेरे भाई।
connected, madam.
Sir, if you have issue with the presentation, you can carry only without presentation also, sir. No problem. Yes.
Yes, sir. No problem, sir. Can I now I'm visible, sir?
Okay, you can start, sir. You are visible.
Okay. Okay, sorry for the interruption. I am continuing.
Sir, ನಿಮ್ದು ವಿಡಿಯೋ ಬರ್ತಾ ಇಲ್ಲ. ವಿಡಿಯೋ ಹಾಗೆ ಆನ್ ಮಾಡಿ ಹೇಳ್ತಾ ಇರಿ.
ಈಗ ಬರ್ತಾ ಇದೆ ಸರ್?
ಇಲ್ಲ ಸರ್, ಆಡಿಯೋ ಬರ್ತಾ ಇದೆ.
ಆಡಿಯೋ ಬರ್ತಾ ಇದೆಯಾ? ವಿಡಿಯೋ ನಾನು ಆನ್ ಮಾಡಿದ್ದೀನಿ.
ಇಲ್ಲ, ವಿಡಿಯೋ ಆನ್ ಮಾಡಿ ಸರ್.
ಸ್ಟಾರ್ಟ್ ಮೈ ವಿಡಿಯೋ ಅಂತ ಇದೆ ಪ್ರಿವ್ಯೂ ಅಲ್ಲಿ.
ಅಲ್ಲೇ
ಈಗ ಬರ್ತಾ ಇದೆ ಸರ್?
ಬರ್ತಾ ಇದೆ ಸರ್. ಈಗ ವಿಜಯ್ ಕ್ಯಾರಿ ಔಟ್.
Okay, sir. Thank you, sir.
Okay.
Spermatic cells. The spermatic cells are germ cells presented in the seminiferous tubules, which are the precursors of the spermatozoa. Germ cells attach cells by cytoplasm. Sertoli cells are very supporting cells for germ cells. Large and tall irregular columns supported protected nourishment for the germ cells. These Sertoli cell very important because it protects the spermatozoa cells and it secretes some hormones and enzymes. Among that, aromatase, which is converts the androgen into estrogen, and secretes enzyme aromatase, which converts the androgen and estrogen. Secretes androgen binding protein, which is very important for the testosterone, and which secretes the inhibin and activin, which also very important because which is the inhibin is the precursor for the spermatogenesis, because it inhibits the FSH and activin increases the FSH level. FSH is very important. Any increase in the FSH levels, we came to know that there is a failure in the testicular failures, especially we are seeing in increasing of the FSH levels. We come to know the status of the spermatogenesis production. Next important cell is Leydig cells, which is also very found in the seminiferous tubules. They produce the testosterone in the presence of LH hormone. Any Leydig cell dysfunction which is low of testosterone, high LH levels, hormone levels, and spermatogenesis. It is a process which is the primitive spermatogenic cell which becomes mature spermatozoa is called spermatogenesis. It has got 4 stages: stage of proliferation, growth, or maturity, and transportation. So by these 4 stages, spermatogenesis will occur, and hormones are very important for the spermatogenesis. The main hormones are LH and FSH and testosterone. But there is another hormone which is synthesized by the liver, which is called SHBG. SHBG is the sex hormone binding globulin, the protein, the hormone manufactured by the liver, released into bloodstream and testosterone. When it binds to the testosterone, this testosterone is inactive. It is not working. But when testosterone, which is not unbonded testosterone, free from the bonding, it is a biological molecule which is very important. That's why some of the bond and free testosterone is known as a total testosterone. So it is very important. The total testosterone and SHBG helps to determine the cause of the infertility and erection dysfunction. Next is FSH, the follicle stimulating hormone, is responsible for the initiation of the spermatogenesis. It binds the testosterone and spermatogonia and induces the proliferation of the spermatogonia.
The normal values we have to know regarding normal values. FSH is 1 point and 12.4 MIU and per ml. And increase FSH, it indicates the, I already mentioned, it indicates the testicular failures. And that stimulates Leydig cells, the secretion of the testosterone. Normal value is 1.7 to 8.6 MIU per ml. Testosterone helps for the spermatogenesis. Normal is total testosterone is 241 into to the 827 nanogram per deciliter. It is very important. Any patient comes to a doctor with low libido or any spermatogenesis problem, we try to write some investigation. One of them is testosterone. If low testosterone, the lack of the libido is low libido is where you can see the low libido, especially of the low test. And one another important prolactin, which is a major hormone while lactating, especially in female, it is we are saying. But in case of level, you have to know if any variation in the prolactin level, it also the impact in the infertility as well as the impotency. Hello. Hello.
Audible but not visible.
Okay, sir. Okay, sir. It is a poor connection. It is mentioning. Okay, I will continue. Can I continue?
Yeah. Continue.
Okay, okay sir. Okay. Okay. Some the factors were important for the male infertility. The male infertility is I already mentioned male infertility inability to propagate in the fertile female partner is called male infertility. The causes are the sexual dysfunctions, anti-sperm antibodies, seminal abnormalities, and unexplained infertility, and seminal plasma abnormality, and congenital causes and testicular damage, and varicocele, hydrocele, and sexual transmitted diseases also there are causes. And some conditions like hydrocele and varicocele and hypogonadism. The hypogonadism, it has two conditions: primary hypogonadism and secondary hypogonadism. Primary hypogonadism, it is occurs in especially Klinefelter syndrome, undescended testicles and mumps, arthritis, and hemochromatosis, and testicular injury. In hemochromatosis, the excessive production of the iron also hypogonadism. And secondary hypogonadism occurs in the hypothalamus or pituitary gland, the Kalman's syndrome, pituitary disorders and inflammatory disease and medication, and obesity. Obesity is very, nowadays it is very increasing. In obesity, the fat cells which converts aromatase into testosterone into estrogen. That is the main cause for the infertility. And semen infertility evaluation, by the three ways we can evaluate the infertility.
हेलो
Tell me, sir.
दोनों अपना अपना डील बनवा दिए संदेश नहीं चाहिए क्योंकि वो टिकट वगैरह का खर्चा हो गया ठीक है रहने दीजिए जो भी है अपना काम बस
Hello.
हाँ ओके हाँ नहीं मुझे आप एक काम करें रजिस्ट्रेशन बाद में लीजिए मुझे कम से कम डिग्री का सर्टिफिकेट तो दीजिए थोड़ा सा क्योंकि वो कंपनी में वो लोग मांग रहे हैं वो मैंने वहाँ पे ये अपडेट किया कि जो आपने यूनिवर्सिटी बताया था राजस्थान का ये सर हाँ तो मुझे सर्टिफिकेट दीजिए रजिस्ट्रेशन बाद में करके दीजिए नो इशू लेकिन मुझे भी पीजी करना है ना मैं पेमेंट को मैं पीछे पढ़ूंगा अभी, पहुंचेंगे अभी वो रात में, तो कल बात करूंगा
सर।
Hello, doctor.
Hello, sir. I'm visible now, sir. I can continue, sir.
Yes, please continue.
Okay, sir. There is so much the poor. I think. Okay, sir. I will continue. The infertility evaluation, the medical history of medical history. Okay, medical history and physical examination investigation. By these three ways, we can evaluate the infertility. Medical history is very important. We have to take in detail histories as per the Ayurveda proforma and case sheet prepared for the, especially for fertility. You have to take in detail. Along with in that, it is very important. I am mentioning some few factors here. Occupation, it is very important. Those who are working in heat atmosphere, they got they also affects infertility. The past history of any surgeries and medical history, any medications also they will affect on the infertility. Any surgery and infections. Physical examination by we came to know that the varicocele, and by rectal examination we will know the any obstructions in the seminal vesicles. The investigations are very important to rule out the male infertility. Very prime tool is semen analysis. Semen analysis before it is a prime tool for the male infertility. Semen, before that we have to know what is semen. Semen is consists of spermatozoa and secretion of the secondary sex. Very important because 70 to 80% of the semen having seminal vesical fluid secretion, and 30 to 40% is about prostate gland secretion, and less than 1% is bulbourethral gland secretion. The two consecutive analysis of required for the evaluation, and we have to know two methods. Two things are very important for the semen analysis. One is for collection, second is method. Now collection, abstinence for 3 to 7 days, it is important. It is needed, and two consecutive reports are to say the male infertility, and can be done in national accredited labs, especially NABL labs. So we can get different values in different labs. That is why NABL labs are very best labs. We can go for the NABL labs for these semen analysis test or any of the tests also. And method is masturbation and coitus interruptus and penile vibration in PESA. It is a peritoneal sperm aspiration and TESA testicular sperm extraction. Also, we will by these ways also we can collect the sample. And normal semen analysis report, it has got so many, according to WHO criteria of 2010, it modified the semen parameters. Previously, there are 20 million is the 20 million sperm count is the normal for the men. So these WHO 2010 guidelines, which was decreased into 15 million, is normal. So we have to follow these new guidelines according to WHO 2010 guidelines. It is very important because these values are from the those practicing in previous laboratory guidelines. The volume is very is 1.5 ml and count is 15 million. And motility is about 38% and morphology is about 4%. These parameters will give the clue for the infertility patient. and normal sperm report. This is about normal sperm report, and we have to interpret these values with the while evaluating the infertility. Shukra, as per the Ayurveda perspective, Shukra Dhatu, it is correlated to the semen and sperm, and Dhatu which are capable of producing offspring is called Shukra Dhatu. Shukra is directly, it is mentioned as Bijasya Shukra Rupasya, means Bija is a seed, it is a sperm, it is direct references. Some synonyms of Shukra, they can give the clue of functions and the position of the Shukra. For example, Teja, Bala, Pumsatva, Paurusha, Arshasambhava, Retas, Virya, Shirasta, Sapta Dhatuja. So these Bala and Pumsatva, they will have some relation with this androgenic activities. Whereas Shirasta, this is a very good synonym, because nowadays we are having an idea regarding HPG axis. It is Shirasta means maybe the brain, the pituitary, hypothalamus and pituitary gland for the secretion of these hormones FSH and LH and GnRH. These hormones are regulating this spermatogenesis. That may be the cause for mentioning Shirasta, the synonym. They go for Palavat Shukra. It is very important because normalcy of the Shukra, it is very, to give the clue of the Palavat Shukra, it is mentioned in Charaka Chikitsasana. It is Bahalam Madaram Snigdam Avisram Guru Pichilam Shuklam Bahu Balavat Sasamshayam. Here they mentioned Bahalam means Madaram Snigdam Avisram Guru Pichilam Shuklam Bahu. The Bahu is very important because number of sperms we can you have to consider here, and the enhancement of the Shukra, the number of Shukras they need for the fertilization. Bahu is thick, Madura is sweet, Snigdha noxious, and Avisra without any bad smell. Guru is heavy, Pichila slimy, Shukla is white. Bahu means refers to the sperm count here. And knowledge of Shukra Srotas, it is very important for the diagnostic purpose and for the management purpose also. The Moola of Shukra Srotas are Moola, Shurshana and Shefa and Majja. The Rushana and Shefa, it is mentioned. The Majjadat, how it is Majjadat means Sneha Bhag of Majja, it transferred into the Shukra. That's why Majjadat is very important. These days there is a stem cell therapy. It is establishing now. Shukra dosha, Shukrasya doshat Klaiba Amarshanam, Rogi Kliba, Alpayu Virupam. प्रजायते नचास्य जायते गर्भः पतति प्रस्रवत्यपि शुक्रम ई दुष्टम सापत्यम साधारम बाध्यते नरम. In Charaka Sutra, while mentioning of the Shukra, the qualities of Shukra, Prasavati means any, if the conceived also by Dushta Shukra, it conceived also, there is we can observe the miscarriage, we can see the miscarriages. Even this genetic information, the DNA and RNA level information, which is we can see the references in the Charaka. The progeny also, they continue with the Virupa and Klibata and disfigured. In progeny also disfigured. Even the progeny, the Sir, audible?
You are audible, sir. You can continue.
The video is disconnecting oftenly. Okay.
So, just carry on.
Ashtashukra doshas. The Charaka mentioned the Shukra doshas into 8 types. Perilam Tanarukshancha Vivarnam Puti Pichilam Anyadhatu Samsushtam Avasadi. Types of Shukra doshas. All infertilities we can manage by these 8 types of infertility, 8 types of Shukra doshas. While Shushruta mentioned Vata, Pitta, Kapha, Kunapa, and Granthi, Utipuya, and Kshina, and Mutra Purusha Gandhi. These types, 8 types of Shukra doshas is mentioned in the Shastras. Among these Shukra doshas, the Kshina Shukra, it is one of the Ashta Shukra dosha, which is caused by Vata Pitta disorder. But why it is important means that there is one report that it is saying that 90% infertility, which refers to the oligospermia. Oligospermia means the sperm count is less than 50 per ml is called oligospermia. It is correlate with the Kshina Shukra. There are general symptoms also mentioned for Kshina Shukra. Mukashoshicha Pandutvam Sadanam Brahmaha is mentioned. These are all the Sarvadika Lakshanas they mentioned. And Nidana also mentioned in the Charaka Chikisasana, Jara, Chinta, Vyadi, Karmakarshana, Anashana, Sri Ati Nishevana. Jara is the age factor. Age factor is very important. If aging, there is a low level of the testosterone, and the sperm production also that varies with the age. And the Manasika Sthiti, it is also important for the production of the sperm production of the sperm. Because mental status is very important for any stress level, it is increases. There is a variation in the hormones you can observe. And Vyadihi, like any Rajakshma, any Grahani, these and Prameha, these may affect, may have some effect on the male infertility. And Lakshanas and Roga and Rogi Pariksha. By the Ayurveda, we have some Roga and Rogi Pariksha. We need to assess the Prakriti, Vaya, and Vyavasaya, and Rogi Ruttanta, Vayaktika Ruttanta in that Ahara, Vihara. Present in the tobacco. How means the cadmium may have the same structures of the zinc and calcium, which replace the zinc and calcium in the body. That's why it affects the infertility. It affects the fertility, because zinc is the one of the molecule with trace element which is helping. That's why the tobacco is very, it is also, it is a positive factor for the male infertility. And in Ayurveda also, there is some researchers, they are established Reto Pariksha. Some research and experts, they established Reto Pariksha in Ayurveda also. Because we have to correlate if you correlate with the modern parameters, the volume, if it is 1.5 to 5 ml volume, the color is grayish. I already mentioned some the normal values of the semen. The pH is 7.2 to 7.2 to 8, and liquefaction time is very important. If snigdhata is more, liquefaction is more. If liquefaction is more, even the sperm count will not able to see. The count is count and motility and morphology. So these are very compared with the volume is Drava. If it is reduced to 1.5 ml, it is called hypospermia. If it is nil, aspermia. So with respect to the volume, any less volume, it is not able to produce these accessory gland secretions are important for the protection of protection of the sperm. That's why the volume is important. The color is shukla. If Ushnata is the pH is 7.2 to 7.8, it is more than that. It is alkali in nature. Below the 7.2, it is acidic in nature. Acidic in nature, and liquefaction time it is below the, especially for 20 to 30 minutes. If more than 30 minutes, it is called liquefaction is more than 30 minutes. It is a mandaguna. By mandaguna, sandraguna, pichilaguna. By kapha, ruddhi, it may leads to liquefaction time more. The count, any ruksha guna is there, the count is less. The motility, the chalaguna, it is of vata guna. Any impairment of apanavata or vanavata, we can see the decreased motility. The morphology is more than 44% has to be there. Any snigdhata, snigdhaguna is involved for the morphology. Any below the 4% is called morphology defect. It is called teratospermia. The three conditions are present, especially low count. It is called oligospermia. Low motility, it is called astenospermia, and low for any shape, any not abnormal shapes, it also called teratospermia. These three conditions also called OAT syndrome. Oligospermia, astenospermia, and teratospermia. It is OAT syndrome. This type of condition, it is very difficult to treat, OAT syndrome, and we'll come to the Chikitsa Sutra. By all knowing the anatomical structure and physiology functions of the reproductive system, and nidana and lakshanas of Kshina Shukra, then we'll go for the Chikitsa Sutra. How to plan for Chikitsa Sutra? There is a reference in the Charaka Sutra Sthana, Majja Shukra Samuttanam Aushadam Swadu Tiktakam Annam Vyavaya Vyayamo Shuddhihi Kalecha Matrayaha. Majja Shukra Samuttanam Aushadam Swadu Tiktakam. The Swadu and Tiktarasa are very important to treat the infertility. By this we can see, especially for Janana, Shukra Janana and Shukra Shodhana Gana in the Charaka. They mentioned Shukra Janana Gana and Shukra Shodhana Gana. One is Janana, spermatogenesis is very important. Then another one is very important, means any defects, any abnormalities, any impairment in the Shukra dosha, there is need of Shodhana. That's why Tiktarasa is mentioned. It is a content of Agni is present in the Agni is predominant in the Tiktarasa, which may correct some abnormal functions of the Shukra. Then it corrects the Shukra. That is why it is mentioned of only two rasas, Swadu and Tiktarasa. And Annam Vyavaya Vyayamo Shuddhihi Kalecha Matraya. These apart from rasa, Anna and Vyavaya, Vyayama and Shuddhihi Kalecha Matraya. It is Kala and Matra are prime factors for treating the Shukra dosha. Ahara, with reference to the Kala and Matra, and Vyavaya, it is also with respect to the, we have to follow the Kala and Matra, and Vyayama also we have to follow the Kala and Matra. The Vyayama also, it is one of the causative factors for the Kshina Shukra. Shuddhihi Kalecha Matra. Shodhana therapy is also required whenever any Dushta dosha, Bahu dosha, the Shodhana is required for the this Shukra dosha. Yata dosham prayunjita doshadato vishagjitam. In the context of Ashta Shukra dosha, Anya Data Dushti, it is mentioned. Anya dhatu drishti, you can see the some dhatu in the, especially for the semen, we can see the rakta dhatu, and it is called hematospermia. In that cases, they mentioned according to that you have to treat the cases. Somanasyam garbhadharanam. Manas is also a very important factor because most of the Rushyadravyas, they can act on the manas definitely. Because if you see in especially Shankapushpi, it is good for psychiatric disorder as well as it is researched as Shankapushpi is spermatogenesis. That's why the fourfold it is where for chikitsa we can plan ahara, shodhana and shamana and sattvavaya. Yeah. Dosha based specific management. In Charaka Chikitsasana Yoni Vapat, it is mentioned that Ashta Shukra and as well as the treatment and specific treatment for the with respect on the basis of the dosha they plan. If Vata is involved in the Vataja Shukra Dushti, the Basti, that is Niruha and Anvasana Basti, it is mentioned. Pittaja, it is mentioned of some Amalaki, Ushira, and Chandana, Kapikachu, Moduyasti, Ikshu, Chandana, and Chamana Prasha. In Kafaja, it is mentioned in the classics. In Kafaja Shukra Dushti, Pippali, Amruta, Loha, Trifala, and Rasayana Dravyas. Anya dhatu dushti adapted as per the dhatu involved in the Shukra dosha. Kunapa Gandhi, it is ghee prepared with the Dhataki Pushpa, Kadira, Dhadima, and Arjuna, Salasarasadi Gana, it is mentioned. In Granthi Bhuta, ghee prepared with the Shetty and Palasha, and Pudi Puya, ghee prepared with the Purushakadi Gana and Vatadi Gana. Sannipataja, it is ghee prepared with the Chitraka and Ushira. And selection, how to what is the general properties of Rushyadravya? Yatkinchit madaram snigdam jivanam brahmanam guruho arshanam manasaschaiva sarvam tadrushyamujyate, it is mentioned. Any plan for the Rushyadravya, there is a need of a general principle. It is mentioned Yatkinchit madaram snigdam jivanam brahmanam guruho arshanam manasaschaiva sarvam tadrushyamujyate. There is an involvement of guna and karmas and manasika sthiti and arshana. These three we are planned because guna is very important and jivanam brahmanam guruhu. The jivana is the karma and brahmana is the karma. Arshanam manasaschaiva sarvam rushyamujyate. Next, in Ashtanga Hridaya, there is a for Shina Shukra it is mentioned Kshine Shukrakari Kriya. Shukrakari Kriya means the Shukra Vardhana, drugs and any substance or drugs and any therapies, anything which enhances the Shukra dosha, all coming under Shukrakari Kriya. Pharmacological activities, we are having, you are seeing so many pharmacological activities with respect to the Shukra. They are mentioned in the Shastras, Shukrala, Shukra Janaka, Shukra Shodaka, Shukra Rechaka, and Shukra Pravartaka, Shukra Stambaka, Shukra Shoshana, and Rushya. Rushya and Vajikarana, they are very popular words, but with respect to Shukra, there is a reference in the Sharangadhara Samhita. They mentioned, they classified Vajikarana Dravyas, Rushya Dravyas, and Janaka, Pravartaka, Rechaka, Stambaka. These these different variants of the pharmacological activities will present in the, they mentioned in the Sharangadhara. Because where we have to use Janana Aushadas, but you are not able to treat a single entity. That's why they mentioned variants of the karmas. But Shodaka, where we need Shodaka, Rechaka, Pravartaka, Stambaka, especially Stambaka means premature ejaculation patients will come. And in that type of patient we will use Shukra Stambaka Dravyas. Shukra Shoshana. In Sharangadhara itself, it is mentioned while mentioning the karma of Shukra Shoshana, they mentioned Haritaki. Haritaki is Shukra Shoshana Dravya. Rushya, it is already mentioned. Next, these karmas, on the basis of these karmas, we can choose treatment, where we can use Shukra Janana in oligospermia and azoospermia, and Shukra Shodhana in pyospermia and pustules, any infection is there, we can use Shukra Shodhana Dravyas. Shukra Rechana, any low volume of the semen. The patient will come with low volume, every parameters are correct. They complaints of only low volume. So if no semen is present, is called aspermia condition. If any low volume, it is called hypospermia. It is called hypospermia. So in that type of cases, we can use Shukra Rechana and Brahmana Dravyas. Definitely will get the results. And Shukra Stambaka, premature ejaculation, Shukrala, oligoasteno, teratospermia condition, we can use once Shukra Dravyas and Rusha Dravyas, semen impairment and semen impairment. And we are having a special branch, the Vajikarana, which addresses all male infertility and male health. You can call it as also Ayurveda andrology or Ayurveda reproductive medicine. By threefold of activities, Vajikarana Dravyas are divided into three categories. One is Janaka Pravartaka and Janaka Pravartaka. So Vajikarana, as we know, which is mentioned for the libido, this science. It is a general idea. But when see the Shushruta mentioned in the Sutrasthana, while defining the Vajikarana, Alpa Dushtakshi, Vajikarana Tantranama, Alpa Dushtakshina Vishushka Retas. And also he mentioned the treatment for Alpa Upachaya, Dushta, Prasada, and Prasadana, and the Kshina, Upachaya, Vishushka, Janana. These are all the treatment modalities mentioned in the Shushruta. And Charaka mentioned two ganas, Shukra Janana and Shukra Shodhana ganas. In Shukra Janana ganas, they are all Jivaniya ganas, they are and these ganas were especially were using for the they mentioned Shukrala Dravyas and Jivaniya Dravyas and Brahmaniya Dravyas, Balavardhana Dravyas, Kshira Janana. They are mentioned small groups. You can use, you can process with the milk and along with the Goduma Churna, Grita, Madhu and Sharkara. When you do this and when you administer these the dravyas along with processed with the milk and Goduma, Grita and Madhu and Sharkara, they may get the Shukramakshayam, Ichitam Shukramakshayam they mentioned. Desired effect they will get. And evidence-based drugs also, these days, the aphrodisiac potentials are also revalidated. Some of I will mention here. For example, cardiosperma helicabum is called Karnaspota, where in classic we don't have any Russia or Shukrala properties there for this drug. Even though this drug, cardiospermum helicabum, it is a balloon wine. It is proved that it increases the sperm count and motility. Ashwagandha, it is a well-known drug. And Jatifala, especially Jatifala Churna, we are using some of the premature ejaculation condition. And Pippali, Shunti, Gokshura, St. Madhu, and Bala and Gokshura Churna you are using, but Bala and Gokshura Churna along with equal quantity, you can mix the Bala. It is a very simple, very easily available drug, and Bala and Gokshura. If you use Sida cardifolia, Glyceria, Grabra, these two drugs, make it a powder and you use along with Kshira or Kshira Paka, you can get good results. And Kapikacha Churna also, while giving the same churna along with water, it is not useful. Like if you make it process with Kshira Paka, it may helpful to the patient.
And Rushya Phalas. They mentioned some of in diet aspects. They mentioned uh, a number of dietetics, especially vegetables and dhanyas and milk products and fruits and mamsa, which mamsa is Russia, which phala is Russia. Everything which is mentioned in our Shastra, Ambra, Ambra phala, Panasa phala, Bija, Majja, Kadali. It is Kadali, even if you have Kadali phala, this Kadali phala having bromelain and which increases the dopamine also. That's why it is very helpful for the production of the Shukra. And Priyala and Shungataka. Shungataka, it is also Rushya Dravya, it is called, it is having reference Shukra Prada. Madhuka, Dadima. Dadima, it is, we will advise Dadima juice for a patient. And Draksha, Karjura, Vatada, apple, and Amrita Phala. These phalas we are mentioned for the as a diet for the patients. Some common yogas we are seeing, what we are practicing. Ajamodadi Churna. Ajamodadi Churna, Ajamoda, it has gone Rushadravya. It has got a Shukrala property. Ashwagandhadi, Talisari Churna, Shilajitavati, Chandraprabhavati, Yogaraja Gugulu, Trifala Gugulu, Vokshuradi Gugulu, and Shivagutika. And in Grutas, we are using Falagruta and Kalyanaka Gruta, Sukumara Gruta, Amrita Prasha Gruta, and Shatavari Gruta. And in Lehas, we are Narasimha Rasayana and Amrita Ballati Gruta, Ushmanda Rasayana, and Bhima Shakti Rasayana, and Brahma Rasayana. These some of the drugs, with these drugs we are practicing. And from Brahma Rasayana, there is a study on Brahma Rasayana. Here Brahma Rasayana, it may correct the genetic abnormal genetic problems with any genetic problem, any chromosomal variations. In that condition, we are using Brahma Rasayanas. And Patya, as a Patya, will advise for Masha Payasa for some of the patients, and Ardraka Kashaya. Why Ardraka Kashaya means Ardraka, which is a source of it will increase. There is a study which is conducted. This Ardraka, it is which shoots the testosterone level. That's why Ardraka Kashaya, it is mentioned for some patients. Druta and daily usage of Gruta and Paya and milk, very important to practice for the as a Anupana, we can advise Goduma, and especially Mamsa, Kukkuta Mamsa, especially they will advise, because these days the boiler chicken they are using in that because they induce they use hormones, growth hormones. That's why it is very this using of regular usage of this the boiler chicken, it may affect the infertility. Apatya, some it is mentioned in the Shastras, Kulatta, it is Apatya, and some using of radiations also, laptops and mobiles, and high radiations, and the wearing of the jeans and tight jeans and exposure to the heat. Heat is very important factor for the spermatogenesis because Shukram Somyam. So it is very Somya in nature. That's why by heat, it may hampers the production of the spermatogenesis. That's why the wearing of the tight jeans and exposure to the chemicals and exposure to the heat are apatya for the infertility. I already mentioned tobacco, how tobacco is causing the infertility. Alcohol also, excessive uses of alcohol is madhya, which is how means it is affects the liver. And the liver is the seat of synthesis of the SHBG already mentioned. Yes, when impairment in the SHBG hormone, there is the production of the production impairment of the testosterone. That's why in testosterone in the impairment, it leads to the low production of the sperm count, and it causes liver cirrhosis. Here we have to for that any liver corrections are needed for the alcoholic patients. And Hitopacha and the Vihara, In Vihara, it is also important because these days very stressful life. Everyone don't have any time to relax, and this stress it may causative factor for the male infertility. For that, we have to follow some exercises and yogas, any relaxation techniques we have to use to correct the mental status and anxiety status also. Anxiety is one of the cause for the male infertility because we will see the performance anxiety also. It is one of the diagnostic factor in the patient. And Padabhyanga, in Shastra they mentioned Padabhyanga and Snana. Snanam, Deepanam, Rishamayishnam, Snanam, Murjam Balaprada, it is mentioned. Snana. If you take the history in detail, while personal history, you have to ask these things because Snana also affects, we don't know. Everyone will neglect these factors. If you go on asking, they will reveal some patients. And Vyayama and Vyavaya in Vihara. And factors for the fertility. For the production and production of the sperm or any production, there is need of kapha, pitta and vata. For formation, kapha, any changes in the sperm or anything, there is a need of pitta because the energy is very required. And for the movement of the sperm, the vata is needed. For that, we can have some plan. We can have some correlation with the formation. We need pranavata, agni, and udanavata. Any changes, agni and samanavata is needed. And in movement, there is a need of vyanavata and agni and apanavata. In sperm also, we will have some divisions like head and mid piece and tail. In that also, we will have some head due to kapha and body. You can in the body we can correlate this one due to pitta. The body functions also varies, and tail due to vata. Any impairment in the tail in vata drishti you can observe, but any abnormalities in the tail, any agglutination or abnormality in the shapes, the vata is very important. And count for we plan for the some treatment schedules for the count. For the count, you can use some Shukrala drugs and Ashwagandha, Shatavari, Vidhari. These drugs will increase the count, and Kokilaksha Churna you can use, and Gokshura, Madhuyashti Churna, Bala, Kapikachu Churna. These will increase the count. For shape, Shukragata, Vata, Chikitsa you can follow. For any movement impairment, you can use Apanavata, correction of the Vanavata and Apanavata. Any volume impairment, you can Shodhana. Shodhana, if you do Shodhana, because maybe obstruction, maybe the obstruction, maybe the Sroto Dushti causes the impairment in the volume. Sroto Shodhana is required here. And the pH impairments also, for correction of samana dosha chikitsa you can follow. Any pus cells, there is an indication of the infection in the genitourinary tract infections. It alters the seminal parameters also. For that, it is need of a shodhana. And also pittahara chikitsa, anti-sperm antibodies. For that also we use amavisha chikitsa. For varicocele and for varicocele siragata vata chikitsa and balya brahmana rasayana chikitsa will follow for the varicocele. Here I will mention especially for grade 1 and grade 2 varicocele conditions we can treat. For grade 3 and grade 4 it is very difficult to treat, but we will advise some surgeries. And especially I am using ZANDU products, especially Vigorex. Vigorex, if you see the combination, it is an excellent drug because Kapikachu, it is a proven drug. It increases the spermatogenesis because it consists of L-dopa and Ashwagandha. It is the best, it is a well-known Ayurveda drug. Everyone uses Ashwagandha. But ashwagandha, the important of ashwagandha for usage of ashwagandha is it is a stress reliever. It is proved that it is a stress reliever, and nowadays it is using much ashwagandha. It is an immunomodulator. And Shilajitu is also rasadravya. We are using rasadravyas here, and pravala and yashada basma. In yashada there is a presence of zinc peroxide and manikya basma. That is why this combination of Vigorex, it is an excellent combination we will use in the so many infertility conditions. They mentioned the low libido, especially diabetes. Diabetes mellitus is one of the morbidity of diabetes mellitus. It is comorbidity of it is very important. It is ED, especially erectile dysfunction. For that, it is a very good drug to use in oligospermia, low libido, and especially diabetes patients. It is very good. And this combination I am using. And along with that, they will any person will meet. They will promote the one single drug, Vigorex. But if you see some of the other combinations also, we have so many other combinations. Because Chandra Prabhavati, it is where I am using. Because so many members, Chandra Prabhavati consists of Gugulo, Shilajatu, Trifala, Guduchi. Especially Chandra Prabhavati, the CP tablet, we are advising for infections and rasayanas and prameha. And Siddha Makara Dvaja Kuti, because the gold basma, it is a very more quantity in the Siddha Makara Dvaja. The Swarna is a proven drug. It enhances the sperm count, especially, and sperm count and motility, and it corrects the shape also. And Sarivadhyasava. So, where is in infections, any Shukradushti, especially for infections, any pus cells we are seeing in the semen parameters, there is increase of pus cells. Just especially for you can use this Sarivadhyasava. Sarivadhyasava, Ushirasava, Chandanasava, these Pitara drugs we are using, especially in the conditions of the Sarivadhyasava pus cells. And Saraswatarishta. Saraswatarishta, it is a Brahmi, Shatavari, Vidari, it is present. Shatavari means the infertility patients with history of 5 years married life, 5 years, 6 years, 10 years, 8 years. More than that, they have some mental status that is varies. They may have anxious regarding their status. In that type of cases, we have to treat mental factor also. For that, we will use Saraswatarishta. So it consists of Brahmi and Shatavari. Shatavari and Vidari, they are Rushidravas and Rasayana Dravas. So especially for performing anxiety, premature ejaculation, it is very useful. And Balarishta. Bala is Balarishta in Bala, Gokshura, Ashwagandha, Erenda. These drugs are also proven drug of male infertility. Especially they corrects the sperm count and motility and morphology. You can use in OAT like syndrome. You can use Balarishta also. In Bala, it is ectidin. It is present in Bala. Will increase the strength. The Yogaraja Gugulu, it is moreover it is a Rasayana Dravya, Panchakola, and Ushira. And Ushta is the Shukra Shodaka Dravya. Ushira is the Pitta Shamaka Dravya, and Panchakola is Deepana Dravya. It is also by this we can use especially in as a Rasayana to correct the impairment of the sperm parameters of Ashwagandha Dilehya and Abraka Basma and Yashada Basma. Yashada Basma consists of the zinc oxide. Some product, these products we can we can use especially these products in of ZANDUs we are using here. Siddha Makara Dvaja. Once again I am repeating Siddha Makara Dvaja and Sarivadhyarishta and Saraswatarishta and Balarishta, Yogaraj Guglu, Ashwagandha Dileha, and Abraka Basman. These products are very helpful. And I am trying to share some case studies to successive stories here, because I have treated severe oligospermia. The oligospermia means the count, the sperm count below the 15 million per ml is called oligospermia. The oligospermia,
there are three gradation we can make. One is below 15 million is called oligospermia, and below 1 to 5, we can call it as well, 5 to 10, we can call it as moderate oligospermia. 5 million and 10 million, it is moderate oligospermia. Below 5 million per ml of count, it is present. You can call it, is labeled as severe oligospermia. I have treated these type of severe oligospermia cases, and not even a single, only sperms are seen in the semen. They are giving the report, occasionally seen report. So for that type of cases, I have treated. I got the results also, because how means we especially starts with the Shodhana. So I will sharing my experience with. I will sharing my experience regarding the cases of the severe oligospermia. Oligospermia, first we have to treat the patient with Shodhana. Shodhana is necessary, but some practitioners, they are using Basti, there are some practitioners, they are using Virechana, and these days there is a difficult task to advise the Shodhana therapies for all, because it is a hectic condition. Those the patients are not having any time to follow these conditions and dietetics, and it is difficult. For that, we used to plan for, especially for some Sukha Virechana and Mrudu Virechana and Sadhya Virechana. I will advise first, and then we will start Shamana Aushadhis on the basis of the condition and Kala and Matra and the status of the patient, any involvement of the dosha. We will look into that. We will plan for the treatment for the.
Sir, please continue.
Sir, it is maybe the out. It is out, sir. It is the time is out.
Sir, you continue your session.
Continue, because it is showing that it is abruptly it is switch off. Any time is out, sir, but I can.
No. You can continue as it is, sir. No.
I am it is audible, sir. I can continue, sir.
Audible.
Okay, sir. Okay. Any more time, sir? It is over. Time is over, or any time?
If still how much time is required, you can continue up to 7 o'clock. Time is there.
How much?
Up to 7 p.m.
7 p.m. Now it is 6:34.
6:30.
Okay, sir. Last, I will conclude, sir, because if I share means I used to share my experiences, treatment, my experiences regarding the treatment, sir.
Okay.
Okay. Thank you, sir. So I have treated with some. I am mentioning regarding the case. Severe oligospermia, I have treated that is one case I am sharing here. One patient, history of 7 years of infertility. He came to the Ayurveda hospital for the treatment. With he is a weaver. It is a poor patient. He consulted so many other modern doctors. He has taken treatment, even though there is no improvement in the semen count, the sperm count. He is having sperm count about only occasional sperm count are seen. I have reports. Those who are interested, I can share, and those who are interested also, I will show you the reports. Reports with the success stories. In that, I have used first Virechana with Phalagruta. The Virechana is in Kashyapa Samhita. In Sharangadhara also, it is mentioned of Virechana. The Bija Shuddhi. Bija Shuddhi it is mentioned to correct the
impairment of Bija dosha, we can use Virechana. I will use Virechana along with the Palakrita and Kalyanakakrita I will use for the Virechana. These two we can advise, we can follow the Virechana principles and Virechana techniques. Along with that, we have to do the Virechana. Then I will advise for some Rasnadi Kvata and Yogaraj Guru for 1 month. Then I will go for the evaluation. And along with that, I will advise Narasimha Rasayana. And then after 1 month, there is an improvement in the 7 parameters. I will, along with that, I will advise some. I will continue the as a Shamanaushadha also. I will continue the Gritas. I will advise Rasayana Dravyas and Shukrala Dravyas. Then I will continue another 1 month and maximum treatment along with these medicine Shamanaushadha is 3 months. After 3 months, I will once again I will send the patient for the analysis and as well as the hormonal lesson. Hormonal lesson. There is I observed that there is an improvement of 3 to 4 million of the increase of the sperm count and increasing of the testosterone levels I observed from this treatment. And also, I used to follow, especially the Patya, the Masha Payasa, I used to advise for the patients. Especially Masha Payasa, it is mentioned in the Shastras also. It is easy to prepare because Masha is a good source of a protein. For that, Masha and Kshira is also, the Satya Shukrakara, it is mentioned Kshira. And Masha and Kshira is a good combination. Along with that, I will advise some fruits, and especially for Adema juice, I will advise. And Adema is mentioned the Shukrala Dravya. Diets, I will advise for these diets to follow. With that, I got the results. And some Rasa Dravyas means in that Abrakabasma and Abrakabasma and Pravalabasma. And the Talisapatra Churna I will use for the moment. Any condition, it is a Asthma condition, I will use Talisapatra Churna for that. But based on very important things in the, I will share my experience means on the basis of the main principle is from Somyam. Shukra Dhatu is a Somya in nature. You have to sustain the Somya Guna of the nature, Somya Guna. Then we have to correct the Shukra Dushtis by Agni and Vyanavata and Apanavata and Samanavata. By these Panchavatas, keep in the mind always to treat a patient and you will get the results. But following of drugs are will get n number of drugs mentioned in the Shastras and formulations also mentioned. The thing is how to give and when to give and how much to give. And this is also will comes by the experience. Normally, we are not able to use the same. We have to evaluate the condition of the. For example, if the semen analysis, if we go to semen analysis, we are seeing so many clues for the infertility status of the patient. I can conclude because the male infertility is a vast area. There is a need of time to share so many experiences. By all these, I conclude. I am very thankful to the organizers and Praveen Kumar sir and Prabhu sir, and I am very much thankful to the Sadanand sir giving me a chance to share my experience and ideas to the doctors. And questions and any suggestions I will welcome. And thank you very much, sir. Sir? Hello?
Excellent, Dr. Nagendra. Excellent. Though technical problem was there, but you have shared your experience and knowledge. We are thankful to you, Dr. Sadanand.
Yes, sir. So I have some just few slides to share. So adding to Dr. Nagendra sir, so we have some important related products related to the male sexual problems, and today we have selected the topic like an Ayurvedic approach to male infertility. It was an excellent and impressive session. It's a technical problem we faced during for the for sharing your PPTs, but we'll next time we will when we arrange, we'll see the things will happen smoothly. So now I just presenting some of the important products from the portfolio of ZANDU. So these are Vigorex SF, and especially thank you very much, Dr. Nagendra Acharya sir. You have mentioned our product Vigorex SF in your speech, and so this is a unique combination as you mentioned, like Atma Gupta account, that is Kaunch, Ashwagandha, Shilajit is there, then Safed Musli, Chandrodaya, then we have Guduchi, Gokshura, Amalaki, along with some basmas like Abraga basma added, then Vishamushti, Praval basma, then Manikya basma, Kantaloha basma, Manikya rasa, Chetifal, and Kapur bars. So these are a unique combination. We made a capsule form like Vigorex SF, it's a super formula, and the doses we recommend, and that dosage you decide, the doctors will decide and judge according to the condition of the patient. But as a pharma company with the standard recommended dosage 1 to 2 capsule, 1 hour before bedtime for 6 to 12 weeks we recommending, and we have a strip pack of 15 tablets. Then another one more product from the classical portfolio, that is the Zandu Siddha Makara Dhwaja Guti. So this is a unique combination, like we have Swarna, Shuddha Swarna, then Makara Dhwaja, Karpura, Lavanga, Kumkuma, Jatifala, Javanti, and some excipients. So this is one. Then we have Purna Chandrodaya Rasam, Zandu Purna Chandrodaya Rasa, that is a combination of Parada Shuddha Gandhaka, then Karpasa Swaras we added, then Kumari, Karpura, Jatifala, Maricha, and Lavanga. So the SQ is from this 100 to 400 mg to recommended doses, and a bottle pack of 2 grams Purna Chandrodaya Rasam from Zandu we have. And Zandu Suvarna Basma also there. This unique product like processed in Lavanda Drava, then Sarkar Dava. So then Channa Kamala and Kasis, that we added the quantity sufficient, and the Suvarna Basma for then 500 mg, sorry. And this is 500 gram pack, bottle pack. Then Zandu Rasayan Churna, we have Guduchi, Goksur, and Amalaki combination, and 2 gram to 4 gram twice a day we recommend with honey, and SQ is 60 gram bottle we have for this Rasayan Churna. Apart from that, we have Ashwagandha Churna. This is purely Ashwagandha, 100%, and SQ 60 gram. Then Ashwagandha Churna, 60 gram. Then we have Ashwagandhadi Leham. The combination of Sarkara, Ashwagandha, Sveta Sariva, then Sveta Jira, we have Mandusnihi, then Draksha, Madhu, and then Gograta, then Suksham with Jala. So 60 gram pack, this one. And we have Ashwagandha Rishta also. So 450 ml, we still maintain glass bottle. And these are all some important products from the Zandu portfolio related to the male sexual problem. So it was a nice session we had with Dr. Nagendra Acharya, and I would like to thank from bottom of my heart to all the participants. Special thanks to Dr. Pawan Kumar Sharma sir and Dr. Nagendra Acharya and all the participants. So we'll sum up this session with thanks. Thank you very much to all the participants, all our technical team, Dr. Pawan Kumar Sharma sir, all my Zandu colleagues, Dr. Tejpal Modi ji, and Mr. Dr. Nagendra Acharya sir. Thank you very much. Thanks a lot.